Hi and welcome. I'm trying to learn medicine. Today, megaloblastic anemia and then after that anesthesia. And if you participate in, and after that, we're going to do wrist training. And if you participate in wrist training, then it's what it happens. So first to the medical part. The first part to the megaloblastic anemia. And this is the third time, the second time actually, just that we're doing the megaloblastic anemia, but overall the 10th part of anemia, or whatever the other types. And we're talking about internal anatomy and diseases and the blood system. And this is no medical advice, we're just using one. Megaloblastic anemia. That is a form of anemia similar to pernicious anemia. Pernicious anemia, there was the stomach not able to produce an enzyme necessary to get the vitamin B12 out of the food. And vitamin B12 is necessary to form hemoglobin. And if there's not hemoglobin formed, then there's not enough hemoglobin. And if someone has not enough hemoglobin, then it's called anemia. Now, megaloblastic anemia is a form of anemia similar to pernicious. Maybe I should mention it one time, but it's also called folate deficient anemia. But now I don't understand the name. Is it now megaloblastic folate deficient anemia or just folate deficient anemia? We're going to say it's megaloblastic anemia. So, megaloblastic anemia is a form of anemia similar to pernicious anemia. It develops if a diet is deficient in folic acid. Okay, folic acid are not enough in the diet. They state here by pernicious anemia, failure of the stomach to produce an enzyme which is needed for the absorption of vitamin B12 from food. So it does not sound like the people don't eat enough vitamin B12, but they're having an enzyme missing. For some reason causes. Wait, was just the causes of it? Nothing written what the cause now what it is. Now here by megaloblastic it seems it's actually a problem of a diet. Or a bit earlier, it develops if a diet is deficient in folic acid, which is present in liver and vegetables. I think they mean with liver to eat liver of other animals, and not that it is present inside of the liver. So it is present in vegetables. Pregnant women and the elderly are particularly vulnerable. The symptoms are similar to those of pernicious anemia. The tongue is sore, smooth and inflamed in places, persistent diarrhea, tingling in the fingers and toes. In severe cases, the facial skin may assume a lemon-yellow tint. The symptoms are similar to pernicious anemia. There and enzymes missing, and when we're going to say tingling of the fingers and toes, and maybe in severe cases, yellow tint of facial skin, persistent diarrhea, and tongue sore, smooth and inflamed of facial skin. Okay, and the treatment is to give folic acid tablets. This is why such tablets are given often as a preventive to those who may be at risk. Okay, I think I have it together. We should just start and look back if something is missing. I'm going to start the camera now. Megaloblastic anemia. The anemia overall, there is a too little amount of hemoglobin which is carrying the oxygen in the blood through the body. And the symptoms of anemia overall are shortness of breath and dizziness and palpitation and pallor of the skin, insomnia, headache and loss of appetite, swelling of the ankles and chest pain. And now by megaloblastic anemia, there is not enough folic acid in the food, that is in liver or in vegetables. And the most vulnerable people are pregnant women and people who are older. And there is a treatment against it, and these are folic acid tablets. And the symptoms of now the megaloblastic anemia, which is a form of anemia, are similar to the pernicious anemia. That is a form of anemia where the stomach is not producing an enzyme necessary to get the vitamin B12 out of the food. And the symptoms of pernicious anemia are tingling of the fingers and toes, persistent diarrhea, and also maybe yellowish tint of the facial skin. And also a sore, smooth and inflamed tongue. Now, and the symptoms of pernicious anemia, the thing with the enzyme missing to get the vitamin B12 out of the food, are similar to the one of megaloblastic anemia. There's not enough folic acid in the food. And that is according to Keith Hodgkin's Family Medical Advisor, page 72 and 73, but this is no medical advice. I'm going to stop the camera. And now we're having something else here, the anesthesia part. I think this is a bit... Oh, I don't know about that. I can't say. Anesthesia. I think it's a bit irritating, but anesthesia here has basically two different things. So anesthesia, loss of sensation in part or all of the body. That is anesthesia. This may occur as the result of injury to or disease of a nerve, as happens in leprosy. But the term is generally used to describe the deliberate medical removal of sensitivity to pain by means of an anesthetic drug administered by injection or inhalation so that surgery can be performed. And not just pain is away, also the other side is also. Now, I think this is a bit irritating. And the book is from the 80s, so is it still technically numbness basically in the body? And the other thing, or is it just exclusively 100% that thing? I would just say as it is written here. We're going to say, and we're going to say first the first thing. Now let's start with the thing which is maybe wrong, which is better. To say first the thing but it is maybe wrong, and then what is probably meant with it, but it's easier, that is better. That's better. Now we're going to say anesthesia means the loss of sensation in part or all the body, which can be a result of an injury to a nerve or a disease of a nerve. For example, by leprosy. In generally, meant with anesthesia is the deliberate, intentionally causing of painless feeling, of no pain feeling, of removal of sensitivity to feelings, to pain, is the intentional removal of feeling of pain or other things through an anesthetist during surgery, so that the person does not feel pain, and also that the person lies still. This is another big reason. And that can be given through injection and inhalation. How about we just start it, and if you mess up again, just do this again. Anesthesia can mean numbness in the body and in part of the whole body, and that can be through an injury to a nerve or disease of a nerve, for example by leprosy. Generally, it means the deliberate intentional removal of feelings for pain during surgery. The person inhales or gets injected and drugs so that this person does not feel pain during the surgery. And that is according to Keith Hodgkin's Family Medical Advisor, page 73, but this is no medical advice. It is really short, so anesthesia. Anesthetic drug, they say that it's anesthetic drug, but it's still a bit short. They haven't even separated between local and total and consciousness and so on. But how about we take it and we come back when we have more. I'm going to stop the camera. No, that was the medical part. If you are here for medicine, you can go directly to the next part of medicine. Then we continue with medicine. If you stay here and participate in the wrist training, then it's at your own risk. We're standing good and stable the whole time, and we're having the hands with front fists next to us, and we're doing the spotlight, fists up and down. Now again, if you participate in this at your own risk, and we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as fast as we can go with a little bit of effort. Next exercise, the flashlight, so inside the fist and the outside. So the second rule, go only as fast as you can go with a little bit of effort. And the third rule, we're not overdoing it. Just want to strengthen, not to exhaust. And we have a lot of exercises. So you're invited to take a break before you... No, you should. Rule 3. Before you're exhausted, you should take a break. Next exercise. We're having flat hands and we're now doing the magician. We're bringing the fists to the outside. The hands to the outside, inside, outside, and inside. Next exercise, the pancake flipper. Flat hands, open and close. One more time. And to the next exercise, the T-Rex in the morning. Flat hands out and bring them down. And up. And next one, the quadrangular castle architect. Fists to the inside, up, outside, down, inside, all the way around, down, outside, up, inside. Next exercise, hands next to us, into flexion, down with fist, down with the arms. You can do the exercise also slower, up, turn around, back and down. So the whole time the fist is at flexion, make a more or less strong fist, and move the arms down and up. You can do this exercise, all these exercises, way slower technically. But we choose to have it on. Now, to the next exercise, the curb anxious to fever. You can take already a break and skip this exercise. Fist down into flexion and press on the outside. And both on the outside. Press on the top. And open. Other hand. Fist front, hand, down with the fist, and press from the outside, seen from fist view, and now both from the outside, seen from elbow view, and press on the top, and open. And next exercise, the T-Rex in the gym. You can use the tennis ball, or you do it without one. You press with moderate force onto the tennis ball, or you just make a strong fist. You release, and you do it again. Release, and do it again. Switch, and do it again. Up and again. And aside. And the next exercise. A cautious big bang. Fingertips with one hand on top of the fingernails of the other hand. Open against the resistance. So press a little bit onto the fingernails. And we'll do it another time. Open and expand all five. And on the other side. And the second round. And now on to the field daisies nurse in fierce shape. Fists. Open, close, open. One more time, and ending flat. And the next exercise is the bascule bridge. Flat hands next to each other and bring them down and put it to the knuckles. Hold it and up again. Another time. Hold it and up. Now I even advise you to take a break now. For the next exercise, the frog testing the water temperature. Hands next to us, bring the hands down with flat fingers. Up with strong fists. Again down. And last time down, and up. And now the claw. Flat hands and make claws. Open and again claws. And open. One more time. And the next exercise. Arms in, strong fists into flexion. And the arms out into extension of flat fingers. Again in, strong fists flexion. Out, extension of flat fingers. In, strong fists flexion. And out. And again. Now, next exercise, the ice X. Flat hand and bend it again at the knuckles and press on all four fingers. And with the other one. Bring it at the knuckles and press on all four fingers. And the last exercise, the unfortunate boosters. Long arm, strong fists, and bring the fists into flexion. And then the extension. Again, strong fist flexion. And extension, flat fingers. Strong fist flexion. And last round. Out. And we're ending with a claw. So go with moderate effort over the middle part of the lower. And on the other side. And wait for us for the wrist training. I thank you very much and until next time.